All right, welcome back to WBTV News at 7 a.m. We have a special guest with us right now, the new health director in Mecklenburg County, Dr. Kimberly Scott. Thank you again for being here with us.
Thank you so much for the opportunity.
We know that back to school season is upon us, as we have covered extensively here at WBTV. Cold and flu season will soon follow the return to the classrooms. Any message for folks for the 2026 cold and flu season?
Yes, we know that we are approaching cold and flu season, respiratory virus season, and it's critically important, one, that we exercise good hygiene, making sure that we clean our hands, sanitize to avoid the spread of diseases if we have or think we might be exposed to those things, making sure that we stay home if we feel like we might be sick, but also doing preventive things to try to protect ourselves against those diseases that we can, like flu and COVID. We know that there are vaccinations that are available to support vulnerable members of our population in the community at large, so it's critically important that we explore resources to get access to those vaccinations to reduce the risk of these diseases. Oftentimes people don't realize that flu can have detrimental impacts, including death, if we do not exercise caution. So our goal is to make sure that people are aware of resources, including vaccinations, to reduce the risk of exposure to those illnesses.
Absolutely.
Similar tips there then for measles. We know we've had some outbreaks recently across other parts of the country.
Yes, Mecklenburg County over the last year had 3 measles cases. We are very fortunate to have a very strong communicable disease team that was able to do investigations and contact tracing to make sure that we reduce the risk of spread of measles when it impacted our community. Measles is highly contagious. We know that it's spread through droplets when someone might sneeze or cough, and oftentimes people associate measles with a rash that might impact the body, but measles can oftentimes develop into other illnesses like pneumonia, swelling of the brain, which is why it's critically important, especially for our youngest residents, our children, that we explore vaccination options to make sure that those risks are reduced and to protect our children. We also know that children as infants are unable to get vaccinated, so it's critically important that as a community we provide that additional layer of protection by immunizing ourselves to support community.
Very, very important message there.
Absolutely. Dr. Scott, thank you so much for joining us and sharing all of that important information as our families get ready to go back to school.
We definitely appreciate it, and best of luck in your new role.
Thank you so much. It's been a pleasure.